What if one of the biggest reasons behind heart attack, stroke, kidney failure, and even weak eyesight is something people ignore every day? It's called high blood pressure, and most people don't realize how dangerous it can be until it's too late. Today, I'm going to clear up the confusion around blood pressure normal range, explain when hypertension becomes dangerous, and show you what you can actually do about it. So stay with me, because this could change the way you look at your health. Hi, in this video, we're going to talk about something millions of people deal with, high blood pressure, also called hypertension. Now, you've probably heard different numbers from different people. Some say 120/80 is normal. Some say 140/90 is okay. Others say you don't need medicine unless it gets really high. So what's the truth? Let's break it down in a simple way. According to medical science, a normal blood pressure reading is around 120/80. If your blood pressure is 120/80, that is considered normal. If your top number goes above 120 and up to 129, while the bottom number stays around 80, that's considered elevated. And if your blood pressure goes above 130 on the top or above 80 on the bottom, then it enters the hypertension range. Now, some people believe that 140/90 or even 150/100 is still fine and that medicine is not needed. But the reality is, blood pressure is not something you want to casually ignore. The main point here is not just which number someone claims is normal. The real question is, what happens in your body when blood pressure stays high for too long? What high blood pressure does when blood pressure stays high, it puts extra pressure on your blood vessels. Think of it like water moving through a pipe with too much force. Over time, that pressure can damage the inside walls of the arteries. And once the artery walls are damaged, bad things start to happen. For example, fat and cholesterol can start building up in those damaged areas. Triglycerides can stick there too. Over time, that buildup can block blood flow and create serious problems for the heart. That is one reason high blood pressure is so dangerous. It slowly damages the body from the inside. And it doesn't stop with the heart. It can also affect your eyes. The blood vessels in the eyes are very small and delicate. When blood pressure stays high, those vessels can get damaged, and that's one reason people with hypertension may start noticing weak eyesight. It can also damage the kidneys. Why the kidneys are at risk? Each kidney has about 1 million nephrons, which are tiny filtering units that help clean your blood and remove waste through urine. Together, both kidneys have about 2 million nephrons. These tiny filters are very delicate. When blood pressure is too high, it can damage them little by little. And that's why many people with kidney disease have a history of high blood pressure that was never properly controlled. In other words, high blood pressure can quietly damage the kidneys for years before a person even realizes what's happening. That's why hypertension is often called the silent killer. It may not cause obvious symptoms right away, but damage can still be happening. What happens over time? Here's something important to understand. Different parts of the body recover at different speeds. Skin cells change about every 3 weeks. Blood changes about every 3 months. brain neurons take much longer, and kidney nephrons also take a very long time to recover. That means if someone has brain-related or kidney-related damage from long-term high blood pressure, recovery usually takes much more time. It doesn't happen overnight. So if your blood pressure has been high for a while, don't expect your body to bounce back instantly. Be patient, stay consistent, and give your body the support it needs. Other problems caused by high blood pressure doesn't just affect the heart, brain, kidneys, and eyes. It can also lower your quality of life in other ways. Some people may experience headaches, memory problems, fatigue, breathing issues, sexual dysfunction, weak eyesight. So if you've been feeling off, and your blood pressure is high, this could be part of the reason. Should you take medicine? Now let's talk about the big question. Do you need medicine? If your blood pressure is high and you are using medicine, the goal is to bring it back to a safer range and protect your organs from damage. Different types of medicine may be used, including medicines from allopathic treatment, and they may work in different ways. Some blood pressure medicines help reduce fluid in the body by increasing urine output. That lowers the total blood volume, which can help lower blood pressure. Some medicines help relax and widen blood vessels, so blood can flow more easily. Some medicines may also lower the heart rate. Now, like any medicine, there can be side effects. Some common side effects may include dry mouth, dizziness, diarrhea, constipation, headache, blurred vision. So yes, there can be side effects. But here's the real question. What is worse for you, the side effects of medicine, or the damage caused by uncontrolled high blood pressure? Because if you do nothing, high blood pressure can keep damaging your heart, brain, kidneys, eyes, and blood vessels. That damage often doesn't show up right away. Many people feel fine until the problem becomes severe. For example, kidney problems may not become obvious until a large amount of damage has already happened. And with the heart, a major blockage may not show symptoms until it becomes an emergency. That's why ignoring high blood pressure is risky. Do you have to take medicine forever? A lot of people ask this. If I start medicine, will I have to take it for life? The answer is, not always. In many cases, the goal is to first get your blood pressure under control, protect your organs, and then work on the real cause through lifestyle changes. That means medicine may be a starting point, not necessarily the final answer. If you want to reverse high blood pressure, or even better manage conditions like diabetes and other lifestyle-related problems, there are 4 basic steps you need to understand. 4 steps to improve it. Step 1. Start treatment. If your blood pressure is high, begin treatment right away. That may include Ayurvedic medicine, homeopathic medicine, or allopathic medicine. But if alternative treatment is not bringing your blood pressure down, you should not delay proper medical care. The goal is to bring the pressure down before your organs get damaged. Step 2. Give your body time. Once you start treatment, be patient. Blood pressure does not normalize in one day. You need time for the body to respond. Step 3. Change your lifestyle. This is the real long-term solution. Fix your diet. Improve your routine. Reduce the habits that are making your blood pressure worse. Your goal should be to become less dependent on medicine over time, not more dependent. And listen carefully, if you are taking any kind of treatment, Ayurvedic, homeopathic, or allopathic, then at that moment, you are a patient. That means your body still needs help. The real target is to stop being a patient by improving your lifestyle. That means, eat healthy food. Exercise regularly. Manage stress. Avoid tobacco. Avoid alcohol. Step 4. Taper medicine only with guidance. Once your blood pressure is coming back to normal and your lifestyle is improving, then you can think about slowly reducing medicine. But never stop medicine suddenly on your own. Whether it's Ayurvedic, homeopathic, or allopathic, medicines should be reduced gradually and safely. The real mindset shift: here's the truth. These habits and treatments should be used as tools, not as a sign that you are helpless. Right now, many people get trapped in confusion. They keep asking, which treatment is right? Which one is wrong? But the bigger question is this: do you understand when and how to use the right treatment? Once you understand that, you can make better choices for your health. And yes, if you work on your diet, your exercise, your stress, and your daily habits, you may be able to improve not just blood pressure, but also diabetes and other chronic issues. Closing, so let's wrap this up. High blood pressure is dangerous because it can damage the heart, brain, kidneys, eyes, and blood vessels over time. It may not show symptoms early, but that doesn't mean it's harmless. The most important things to remember are: know your numbers. Don't ignore hypertension. Use treatment if needed. Fix your lifestyle. Never stop medicine suddenly. Memorable takeaway: high blood pressure is silent, but the damage is loud.
Thanks for watching Vitality Health Works. Small, science-backed habits build lasting health. Start today. If this helped, like and subscribe and turn on notifications. See you in the next video.